We have noted that there are serious allegations against a number of departmental senior officials, notably that of our Deputy Director General responsible for health regulations and compliance, Dr. Anban Pillay, who at the time of the awarding of this contract was the Acting Director General when the contract of communication was awarded to the company Digital Vibes. From our side as Ministry and Department, we have had a chance to review firstly the first investigation which was done internally by the Ngubane company, and also now that we have the SIU report, we have had an opportunity to look at this report. Let me just emphasize on the fact that while we had some communication before through what is referred to as referral letters, the actual full report we only obtained yesterday, and with us over and above the report which has been circulated, we're also furnished with also annexed documents. So yesterday, myself and the DG, we received a thick file there, which sitting next to me and Deputy Minister Dlomo. So that is the file which we have been studying yesterday and over the night and early this morning. That file contains the full information with annexures. So I'm just emphasizing the fact that there's a perception that maybe we've been just sitting on the report when we've had some access of some snippets where there's some of the matters which have been referred to us, but the full report and annexures we only got yesterday. So we've gone through these documents. Now this report and the documents indicate misconduct, possible misconduct by 9 officials. But it's important to indicate that 3 out of the 9 are actually not in the department. One was previously in the department, our former Chief Financial Officer, but who subsequently joined another government entity which reports to another government department. So out of those, in terms of this particular aspect of the report, there are 6 officials who the Acting Director General has to take steps against. The other 3 officials are employed by, as I've said, other government departments, and the Acting DG has already been in touch with their heads of departments to inform them in terms of what steps are we taking and what is expected, therefore, out of those who are in other departments. Now, that leaves us, therefore, with 6 officials who are implicated in this report, as I'll indicate later on, but when you add our DG, then it goes to 7. We are anxious to conclude the disciplinary processes as a matter of urgency, to bring these matters to closure in order to have time to dedicate our time and energy and resources to the country's response to COVID-19 pandemic as we roll out the vaccination program. But also bearing in mind that as a department, our responsibility is not only in terms of the COVID-19 pandemic, but we have what is called a quadruple burden of disease, infectious diseases, non-communicable diseases, violence, the mother and child health, all those aspects of prevention of disease, looking after those who need admissions to hospital, providing prevention through other inoculations, other preventative measures. This is all what is primarily our responsibility. So we are hoping that we can go through this process such that it gives us space so that we can focus on our core business. By the close of business today, all affected 6 officials in the Department of Health would have been served with suspension letters. The Acting DG has been working on this since yesterday. He's been also making sure that the affected individuals are actually informed. And as we were coming in, he just confirmed that in terms of starting the process of engaging and informing them of what is coming. He has already done that as of now. So what is left, the letters are already prepared. It's just handing out the letters before the end of business today. So the outstanding disciplinary investigations will then follow, and investigators have already been engaged, and they will then communicate with the SIU for further briefing. And also it's already been indicated that they might also need further information from other sources within Treasury and other parts of government. So the number of suspended national health officials by the end of today will be 7, because as you will be aware that the DG, Dr. Buthelezi, has already been put on suspension. And just to explain how this works, DGs are appointed by the president in terms of the public service. So when there's an issue relating to director generals, it goes to the president's office. So that's why, because the president already, his office already had their full report, so they were able to start acting earlier and took the steps and informed us. They kept me informed in terms of every step, and finally arriving at a step where the DG has been suspended already. So by the end of business today, 6 other officials, and which brings them to 7. So as I've said, the acting DG, just to indicate some of the departments, acting DG Dr. Nicholas Cripps has already written to the DG of government communication, where one of the officials who's implicated, the other 3, is in that department. The Department of Agriculture, Land Reform and Rural Development, and then our former CEO is currently CFO, is currently the CFO of the Government Printing Works. So the acting DG is communicated with the DG of Home Affairs and also the CEO of the Government Printing Works. So to inform them on the steps we are taking, so that they can work with him to also take similar steps against officials who are implicated in the report. And the intention, therefore, is to explain to those departments the course of action we are taking, and then give them an opportunity to work with our department to take the similar steps so that we can streamline the processes. It must be emphasized that disciplinary processes are an employer and employee matter, and and we follow the public service as governed by the Public Service Act and its regulations. The report does show that indeed whistleblowing is one of the very effective mechanisms in the fight against corruption and corrupt activities, and it plays a role in encouraging accountability, transparency, and high standards of ethical behavior and governance, both in our public institutions, but also, we hope so, also in the private institutions. So the blowing of whistle was taken seriously within our department and also institutions such as the SIU, and this stand taken by an individual and individuals and by subsequent witnesses has brought us to where we are on this matter. We fully understand the public concern and interest in this matter because it involves allegations of misappropriation of public funds in the middle of a major fight against a pandemic, the COVID-19 pandemic, which has so far caused the country substantial spending of unbudgeted funds, as well as costing many, many lives. We have already passed 87,000 recorded lives lost from this COVID-19, and also livelihoods. Thus, we are committed to do further studies on these reports and findings, recommendations, so that we study them fully, and so that we can act on the outcomes over and above just the formal disciplinary processes, These processes will also be undertaken without fear, favor, or prejudice to any of the individuals who are implicated. We're also committed to clean governance, and despite the fact that this does make the situation, as you can imagine, in the department very uncomfortable. We're talking here about a big number of senior officials who are implicated, who work with all of us on a daily basis. But we take this very seriously, and we will tighten controls and ethical practices. We take seriously the evidence gathered by the SIU and have noted the view that there may be scope also for criminal charges. Though we are mindful of the fact that there probably further investigations may need to be done in this regard, and also knowing the approach of our legal system, that until somebody is found guilty in a court of law, they remain innocent. But we take cognizance, and that's why we're taking precautionary suspensions, because the allegations are very serious while awaiting the formal processes. So we know that we must follow the rule of law. The SIU findings will guide us in looking into the alleged conduct of officials named in the report and assessing the disciplinary steps, corrective and preventative interventions that will be required. We would like South Africans to have confidence in our public health system and in the integrity of hundreds and thousands of government officials and public servants, and especially in our space of providing health to the public. It doesn't help when there is a lot of suspicion on the people who must run the system. So we want to assure the public that we will do everything possible to correct this. Because we are conscious of the fact that there are many hundreds and thousands of honest public servants, both in our department and elsewhere in the public service. Many who go about doing their duty, if you speak especially in the health system, in our clinics, in our hospitals, everywhere, very honest public servants risking their lives on a daily basis. And this kind of development just demoralizes them, and it's our responsibility to bring back their morale and their trust. We'll address matters of integrity and of consequence management concurrently, and we'll make our decisions known as we go on. We will do so within the framework of the law, and especially guided by the Public Service Code of Ethics, and also the codes of disciplinary action, and also within the context of natural justice. As I conclude, I would like to unreservedly tender our public apology to all South Africans for this very unfortunate and really, very devastating saga in terms of the confidence of the people in our institutions. And we would like to assure the public that we are going to thoroughly and decisively act and ensure that nothing is swept under the carpet. We acknowledge the impact of this on the image of our department, the Department of Health, especially in terms of our capacity to provide public services. So it's not just a question of image, but it's also a question of, it's really done a very devastating impact on our own capacity. As you can imagine, we're just at the tail end of this third wave and looking forward to how we can stabilize the health system. We're also pushing on a vaccination campaign. As we speak to you today, the President and the Deputy President have given marching orders to all of us in the cabinet, ministers and deputy ministers, communicated with premiers, that we must all put our energies over the next 3 days starting tomorrow to really, push the vaccination campaign, the uptake of the vaccination. So all of us are instructed by our leadership to be out there in the local areas all of us in our district where we are allocated to ramp up the vaccination campaign. So the last thing really we need is the detraction from that by this kind of a situation. But also just in terms of capacity, you can imagine we are doing this in a department currently where you have a DG who is on suspension. You therefore have to have an acting DG who has been a driver for the vaccination program. So he's got to be removed from that. And then we have a Deputy Director General who is also seriously implicated as we speak. From when we leave from here, a few hours from when we leave from here, he'll be out of office. We don't know for how long. He's got to face the allegations. We have about 3 other senior officials in the department and 2 on a more junior level. So all those people, are going to be out of circulation. And I can tell you that this happens at the time when already in the department, we already had a lot of acting managers, senior managers. We have as I said, the CFO had left. We have the acting CFO. We've got about 3 acting DDGs because one of the DDGs has long been seconded to the Northwest as an administrator of Section 100, and then other 2 DDGs left. So we've got a lot of thin management capacity. So this is just, but we want to assure the public that notwithstanding that, we will feel the impact, but we will do our best to make sure that the services on the ground don't suffer immediately in terms of the fight against COVID-19, including the vaccination program, the support to our colleagues in the provinces in terms of making sure that the health system itself, that's what we're focusing also on, the capacity beyond just COVID, dealing with other challenges of health services. We're going to do our best to make sure that all this destabilization does not ultimately affect the capacity of the health system, the public health system, to deliver services. Thank you very much.
Thank you, the Honorable Minister, for the brief sharing with us. Without wasting any time, we're going to take the questions. We're going to take the questions from the floor and also through our social media platforms. So we are going to start with the questions that came through the social media platform. So I'm going to allow my colleague who's going to facilitate those questions, Ishmael, to read the first batch of the questions so that we can allow our leaders, the minister, the deputy, and the acting DG to respond. Ishmael, first question.
Thank you, Chairperson. We have a few questions on the WhatsApp groups. The first set of questions are from Brian Sukutu from the Citizen. Is the minister able to supply names of 18 people linked to the digital vibes scandal? The second one from Brian. Former acting DG Dr. Pillay is still in office. What happens to him? The second set of questions, they are from Tulasizwe Similani from ENCA. What exactly is the content of your communication to the department where the other 3 officials are now stationed? Are you asking or encouraging those departments to follow suit in suspending those officials pending disciplinary processes? Would you view it as unacceptable if those officials were to remain in their positions in those departments? The third set of questions, they are from Kaogelo Magoleho from UFM. The minister was there serving as a deputy during the time of the Digital Vibes deal. Did he play any role in it? Who in the department took the decision to appoint a company to conduct an investigation into the matter when the SIU was probing? How is this not wasteful expenditure that should itself be investigated? Kindly justify why the department needed to appoint PR firms while it employs a significant number of people in its communications unit. Chairperson, the fourth set of questions is Jason Felix from News 24. The National Department of Health announced that the suspension of Health Director General Dr. Sandile Buthelezi over the matter. Why was Dr. Anbay Pillay not suspended earlier for his role? How will the health ministry prevent this sort of irregular contract with unscrupulous companies? Has any steps been taken to prevent this sort of corruption? If so, what are the details? Is the minister of the view that the digital vibe scandal will affect the country's national COVID-19 vaccination drive? The last set of questions is from Tamakan from Business Day. Minister, point of clarity, are the 6 officials being placed on precautionary suspension or being suspended? Can you elaborate on the steps you say you plan to take to tighten controls within the health department to try and avoid a repeat of this scandal? That's all on the groups for now, Chair.
Okay, thanks Ishmael. I'm going to allow the Minister, Deputy and the Acting DG to respond to this first batch of questions before we take the next batch from the floor.
Can you do from here or?
Because of the mics, you have to come here, Minister.
Yeah, they were quite sometimes very fast. I tried to capture everything. I know that there's been some media circulation talking about 18 people. We're not aware of 18 people. In terms of what we have said here, all in all, in terms of when we include the DG, is 10, yeah. It's 10 when we include the DG. As we have indicated, 6 in the department, 7 with the DG, and then 3, it's people who are in other departments. Of course, the former CFO, who's also left, previously was also in the health department. The others are implicated in terms of their role during the procurement process, because when these committees of procurement are put together, it's not only members of the department, they also do invite participants in the committees, adjudication and so on, and that's how that comes up. The question of why, I think it came more than once, why Dr. Anban Pillay was not suspended earlier. As I've indicated, the suspension of DG Buthelezi was undertaken from outside my office, from outside the National Health Department, because as a substantively appointed Director General appointed by the President. So when the report, the referral of indications that there's allegations of misconduct, they went straight to the President's office. And so that process and was run from there. And as I've indicated, that office over and above the referral letter, they also had the benefit of the full report. So they were able to formulate, they kept me informed, but they ran the whole process. I was only to be informed that this is happening. And even when the suspension of the DG was not signed by myself, because it's outside my scope, as I've indicated, President can select other colleagues and delegate, but not the minister of the portfolio. So that was handled in that way in which all other DG's matters are handled. So we're only able to act as of today, notwithstanding the fact that the talk about Dr. Andan Pillay was there. In the Ngubane report, it also said that he played a major role as a DG, acting DG at the time. But without substantive documentation, we really couldn't take any further steps. I know that even when they would be in the portfolio committee, some members of the opposition would always be asking, especially after the suspension of the DG, but you still have Dr. Pillay. He is highly implicated. But I said, you know better, I don't know, you're telling me. I have not received the documentation. So now that we've got the documentation, the action has been taken, and he will be out of the office by before the end of working business today. In terms of what the acting DG will be expecting from other departments, he will be able to handle this. There was a question, I can't remember who it came from, as to my role as a deputy minister at the time of 2019 up to just over 7 weeks ago or so. Yeah, maybe about 7 weeks ago. Now, the issues of the appointment of the company, I had absolutely no role because this was really a matter which, I'm sure those who have read the report, I don't have to speak for myself. And it's not a question of wanting to badmouth other colleagues, but you can read the report, and you will find in that report, you won't find anybody who claims that in the process of procurement or implementation, Deputy Minister of Health was consulted. You won't find any such indication. So I can leave it there, just refer to the report, and you'll find that definitely as a Deputy Minister, I didn't have any role either in the appointment or in the implementation of the particular contract. There's a question as to why a company to investigate was appointed. Well, I think the criticism might be valid in one way or another, but when there is a complaint, remember that also this matter arose from the report of the Auditor General, that the Auditor General had also flagged that there's indications of irregularity in this matter. And therefore, based on that, you can do an internal investigation, but it's also acceptable to contract an external party. Remember, at that time, the SIU, I don't think the SIU at that time had even started. I don't think when the DG appointed the company, I'm not aware of the fact that I think almost somewhere as that company was working, the SIU had the whistleblower tip to say there is something happening. And that's why, just as that report of the Ngubane company was concluded and announced, then the SIU also announced that it was also doing an investigation based on a whistleblower. And it was then agreed that the report, I think the SIU also then asked for that report, and from the department as well, the DG had already acknowledged that that report also has to be given to the SIU. So the fact of whether it was wasteful, I wouldn't really want to pass judgment, because the idea of now and then when there are allegations can get an external party to come and give an impassionate kind of view on the matter, it is normal practice. So, and especially if you look at the sequence of events, it might not necessarily have been a wrong thing. The question of why, in principle, why a communication company when you have structures in the department, it's true that we have a communication department, which is where Mr. Foster Mohale comes from, which is headed by one of the chief directors, Mr. Popo Maja, as you would have seen in the report, who's also mentioned as having played a role. Now, in various functions of government, we always try to make sure that we make do with what we have internally in many services. But from time to time, depending on the magnitude and the complexity of the task, it is also normal practice. As long as you follow the correct procedures, you have to justify why that particular task has to be outsourced, or you need extra capacity. That's why you have the Treasury regulations, the PFMA, which guides you. And that's why even in this process, You would see in the report that the National Treasury had to be approached, you had to get approval, you had to justify what is it which it's extra to the normal work, not only in terms of volume of work, but the complexity of work. So those things do happen. So it's not something which never happens. But and it's possible. I mean, I can say to you now, even as we speak, in principle, the issue of extra capacity. If you look just, for instance, even now what we are dealing with, the whole issue of, mobilizing the public on vaccination, and that's why you would hear also even members of parliament complaining that this is not a matter of the promotion of vaccination, of mobilizing society, can't be carried by simply the kind of capacity you have in your department. And they bemoan the fact that money which should have been used effectively to mobilize society get extra capacity. And they bemoan the fact that we lost money, which otherwise would have been used fruitfully to get extra capacity, to make billboards, to do all sorts of communication paraphernalia, get more experts in terms of social behavior and so on. So the principle of the fact that from time to time on major challenges, including the one we are going through, which is far above the normal actions and the normal activities of a health department. The fact that when you are faced with challenges like those, you may actually need extra capacity. I think that we shouldn't take away that. So even now, as we go through this, we have been trying to work around to say, what are the areas in which we still need extra capacity to reach out to the public, the young people, mobilize and so on, and make sure that our messages are tailor-made. So I'm just emphasizing the fact that, so we mustn't then be sidetracked by this unfortunate saga, that in principle, a government department seeking extra capacity from experts outside its own employees in itself is wrong. That is not the case. It's just a question of how do you do that? How do you identify? How do you go around it and make sure that when it is done, it's done properly with integrity? So I think I've, in a way, already responded to the issue about Dr. Pillay, that until when yesterday when we were able to get all the documentation, we were not able to do that. In terms of future prevention, I'll ask the acting DG to talk to that. And also, but just as he comes in, just to say that, as we have said, what we're issuing today is precautionary suspensions to say you have got serious allegations against you. It will not be good for you to be, as you have, there is further finalization to check as to whether you should face a disciplinary process. It doesn't help both the image and also the free and fairness of the investigation if you are still in office, because some of your colleagues may have to be asked questions. And how are they going to feel free to respond if if they are leaving you in the office to go and answer questions about you? So that's why this is called a precautionary. We hope it will be short so that the actual process can be concluded, so that the decision then is taken. And if the decision to say go DC, then it should be done speedily. Because the SIU has done a lot of work already. We have the report. I don't think this is going to be long. It's probably a matter of days, and then the matters will be finalized. And then if the investigators who the DG is appointing conclude that so-and-so must face the DC, that will happen speedily. I believe that will be so. I'll ask the acting DG, and I'm sure Deputy Minister may want to comment on some of the areas. Yeah, acting DG, there's a lot of issues you must respond to.
Thank you very much, Minister. Deputy Minister, good morning to everybody. So the questions that I was asked to respond to are about the content of the communication and whether we would find it unacceptable if others remain. So as you heard, we received this report yesterday and had to get preliminary insights and opinion from our lawyers who are appointed as the investigating officers yesterday to see whether there are charges that can be preferred against anybody based on what is, and that's from a disciplinary, labor relations and public sector perspective. And there are questions that are raised about clarity on certain issues related to procurement process and statements that are short in a written document that our investigators may wish to clarify with the SIU. That is normal. So in the meantime, what I've done is I've spoken to the accounting officers in the institutions concerned orally, and the letters are being prepared while I'm here because I've spoken to the lawyers to prepare the letters, but at least I've spoken to each of them over the phone to inform them what we are doing in the health department. Now, this was one process of one tender, so there will be merit in us working together and following the same process. But they are accounting officers of their own departments, and it's not for us to prescribe what other departments should do. When we leave here, I will continue the conversation with the 3 accounting officers concerned to see what they have chosen to do. Clearly, we have to provide them with information and something in writing so that they are able to make an informed decision on what to do with the 3 people concerned. So it's what we do in government. We don't work on our own, and we don't tread on the territory of somebody else's accountability. Would we find it unacceptable? Well, obviously we would prefer to be consistent, but that is a discussion that I will have with the accounting officers concerned. So the question about what do we do to prevent this kind of thing from happening? So the mechanisms are in place that these kinds of incidents should not happen. But sometimes people are sucked into a process willingly or unwillingly and are unable to get themselves out of the process or don't realize soon enough that the process is flawed. The prescripts are fairly complex, and not everybody who is involved in a procurement process understands exactly what may or may not be done. So for people like myself, I will revert to a lawyer or somebody whose daily business it is in procurement. Now that was actually done. The department did revert to Treasury, and whether at that time they felt that they were following a particular unacceptable process or not was a decision taken that we can't account for now and is subject of this report. But that is the process that one does, is you are vigilant all the time. Now we have an even heightened vigilance. It slows things down a little bit because we're asking for opinions all the time. Some things are quite subtle. There are many rules around what one may or may not do. There are rules around written delegations to allow people to take certain decisions. And sometimes when pressure is on and there's something big that's happening, like the COVID epidemic, people do not put things in writing, do not confirm with the lawyers concerned that we are, or sometimes it's not lawyers, but people who understand the public sector. And mistakes get made. So we in the Department of Health now, the National Department of Health, are extremely vigilant, more vigilant than perhaps one is normally, and we will just do what we can to make sure we get advice on every turn. There was a question about tightening of controls. The controls are actually quite tight. It's when people take shortcuts on controls or are trying to do things in short spaces of time that mistakes get made. And sometimes it's better to just delay for a day or 2 or 3 and wait for an opinion before those controls come. I want to repeat what the Minister has said. The people in the department are on precautionary suspension. Charges are being formulated. Now, the charges get formulated by the legal representatives. They are attorneys who are appointed by us in the department with the support of the State Law Advisor. There are senior attorneys who get appointed to these positions, and they will formulate the charges. To do that, they will extract the information from the SIU report, and anything that is not clear to them, remembering that they have to lead the evidence in the disciplinary hearings, they will have to go back to the SIU to obtain clarity from the officers in the SIU, and anything that they are still unclear about, they may need to go to experts and ask them to clarify, so that when they have a case, when they believe they have a case, they can formulate very clear charges against people. There may be cases where there are no charges formulated, or the charges are formulated differently. That is not for us to decide. That is why we appoint investigating officers to do that. And as the Minister said, we will get to the disciplinary as rapidly as possible, but we are definitely not going to tread on the rule of law here. We will follow step by step exactly what is required. Thank you.
Thank you, Minister. Thanks, the Acting DG. Maybe before I take the questions from the floor, I want to check with the Deputy Minister if he wants to add anything. Or Minister, I want to...
No, I was just saying we also pressurize for some other appointments, so if you can be the last round.
Okay.
Here.
Yeah. So I'm going to plead with colleagues who are here to bring all the questions on board, forward, so that we deal with them once off, so that the Minister and the Deputy needs to attend other commitments. So I'm going to take the questions. Heidi, who's next? Isaac, who's next? Oh, so we've got only two colleagues that will be asking the questions on the floor. So raise all the questions that we have, so that we deal with them once off. Thanks.
Thank you. It's Heidi Jockers from ENCA. I just want to ask if you could please just clarify the 7 that have been issued precautionary suspension letters. If you can just give us their names, because there seems to be some confusion as to who the 7 are. Then with regards to the 3 that work for other departments, who are those 3 and which departments do they work for currently? And then in terms of the 150 million rand that was irregularly spent, surely this is a concern, and the department hopefully is in the process of trying to recover that money. And the question basically is, isn't this a concern? We're in the middle of a pandemic. There's a lot of vaccine hesitancy. Surely that money could have been used and diverted for other things, saving lives and also important vaccine campaigns. What is the department doing in that process to recover the money? Thank you.
Isaac Mahlangu from the Sowetan. Just 2 questions from me. We knew as early as probably around July that there were steps or systems that were not being followed in the department. Has the department taken any steps to try and correct those weaknesses which are identified in this report? And we know for a fact that this 150 million was not budgeted for. Any projects which had to be shelved for this money to be made available for this NHI media campaign?
Okay, any last question before we allow? Okay, yeah, I'm going to allow the Minister, as we respond to these questions, also clarify the issue of 18 numbers versus the 10 that we have talked about.
All right, no, thanks for the questions. As we said, I think we just got the clarification on the 18 versus the 10, that the 18 is the total number of referrals from the SIU, including not necessarily to us, to government, but also to the NPA. Remember, they are outside, there are people who are implicated, but who are not government officials. And as you read the report, you'll see the names of various people who are implicated in the report. So that the number of 18, therefore, is correct, as mentioned in the media, but it includes people who are not in our employ. So I think that clarifies that. So Because this is contained in the report, we can just mention that we have already mentioned, we know that DG Buthelezi is already been mentioned, and then DDG Dr. Anban Pillay has been mentioned, Mr. Popo Maja, who's head of communication, Patricia Ngobese, Shirin Padesi, Sfiso Dlamini, and Mkolisi Zondi. These are people who are in the health department. And then those who are outside the health department in government is Reginald Ngobo, Agriculture, Senzeni Ngubane, GCIS, and Mr. Ian van der Merwe at Government Printers. So that gives you the complete list. In terms of the recovery of money, the SIU can speak more authoritatively about that. From our side, as the Department of Health, all that we can do is to take corrective steps internally through the disciplinary processes and also tightening controls, as the acting DG has indicated. But in terms of, I think the SIU, as they've gone public in terms of approaching the tribunal and other legal processes in terms of recovering the money. So that's actually their terrain. They can speak more authoritatively about that. The fact that we knew about the irregularities from July, indeed, the first time when the internal report came up was in July. I think actually in June. That's when the internal report came up. And then, of course, that report was forwarded to the SIU once the SIU made it clear that they were also investigating. So, and the approach in terms of further interventions, we of course had to then wait for the complete. As mentioned, it doesn't mean that the weaknesses which have been identified were not being acted upon. I think clearly the work was not yet complete, but because there were matters which were highlighted in the external investigation of weaknesses in the systems, clearly steps were already being taken in that direction to tighten up those loose ends. But what we are saying is, now that we've got the complete report, it gives us even more confidence in terms of going forward and saying that, these are the things which have been clearly identified, and over and above the steps internally, in terms of on individuals, in terms of systems, these are the other steps which we need to take. I'm sure Dr. Crisp may want to add.
Yeah, thanks very much. So in terms of the specifically the recovery of funds, I think we must be very clear that that's not the responsibility of the department to actually recover the funds, but it is something that we are obviously interested in, so we will cooperate to identify the funds, and obviously we'd quite like to see them reallocated to the department for use in the department. But there's a different process that's followed by that in government. As far as where that money came from, the 150 million rand that is spoken about, so what happens during the course of a financial year is that we budget ahead of time, we have to spend against that budget, and if we want to move money, we have to get Treasury permission. There are different levels of permission and different kinds of regulations and rules around the moving of money. For instance, moving conditions of employment money in or out. So either goods and services money into conditions of service or the other way. There's a very deliberate and different route for moving that money. If we want to move money within the programs of the government department that is published in Parliament, there's a separate process to deal with that, obviously, because that is a parliamentary bill. But if we are working within a program and moving money, then there are certain levels to which we have to go back to Treasury, and if there are smaller amounts, we can do it within the department. So there are quite different sets of rules depending on what you're doing. So what happens during the years, if monies are required for a different process, we will look within our budget to see where we are underspending, and we will see if we can move some of that money to a particular new need. So that's what happened in the case of finding the 150 million. There would have been some money, but insufficient to do what they wanted to do at the time, and there would have been money moved, 20 million here, 10 million there, or whatever, pulling out. We go through that. We're going through the process at the moment because we're nearing the end of a financial year, and so we look to see where have we had savings because of other activities, and we move it to where we know there's a pressure and demand. So that's not unrealistic. There was another question about from Tamar Khan about how to, what are we doing about senior management capacity, because the Minister said that we are very thin on the ground at the moment. So the Department of Health has been going through, since Dr. Buthelezi was appointed, been looking at a new organizational structure to respond to some of the differing and changing demands in the department. That process has been going on for some time, and we have reached a point now where we have prepared a submission to the Department of Public Service and Administration for a reform of our organogram. In the meantime, these vacancies we have spent in the last 2 to 3 weeks since I've been acting DG, looking very carefully at which of the posts that are currently vacant match our proposed organogram for the future, because we don't want to advertise vacancies if they are not going to appear in the new organogram. We have now identified that, and in the department this week I've been through with our corporate services, DDG, exactly which posts have already been advertised and are ready to fill, which we have scheduled appointments for some interviews next week and the week after for certain senior posts. There are a couple of posts where we didn't get sufficient people applying for the job of satisfactory level. We are re-advertising those posts, and there's one post that's already been advertised twice, and we now, in terms of the Public Service Act and regulations, are going to go out with a headhunting process to see if we can find a senior person with the skills for that post. So the processes are happening. They're obviously of interest to me as the acting DG at the moment, that we fill these posts as fast as possible so that we can get some stability in the department. Thank you very much.
Thanks, DG, Acting DG. Thanks, Minister and Deputy Minister. I know we are pressed for time, but I don't want to be branded as a gatekeeper by the journalists. So just to nurse my feelings of the journalists, I'm going to take the last 3 questions that came through the social media. Ishmael, can you read them out?
Thanks, Chairperson. We have Llewellyn Prince of Network 24. Has there been any formal contact from the Hawks or the National Prosecuting Authority with regard to the digital vibes matter? The next one is Vikas Vega, Network 24 as well. Will the department lay criminal charges against Dr. Mkhize, Dr. Pillay, and other officials? We have a question also from Patrick O'Leary from the Fleet Watch magazine. Will the suspended officials be suspended on full pay? And if so, how much does this total per month? The last one, Chairperson, is Bongi Wazwani from Newsroom Africa. Minister, you talk about tightening of controls, which is critical going forward. How do you plan to do this at a practical level? Lastly, have you spoken to former Health Minister Dr. Zweli Mkhize, and has he said anything to you about how the department got to this point? That's all, Chair. Thank you so much.
Okay, thanks, Chair. I'm going to call upon the Minister, the acting DG, and the Deputy Minister if he's got some ways to add.
Thank you. The question of whether the Hawks and NPA, our understanding and on this will be guided, Acting DG, I'm sure, will be guided by the SIU as the lead entity as to whether we have any role, because they have done the in-depth investigation. I'm aware that, as indicated, that in the 18 referrals, they also mentioned that that includes referrals to the police and the NPA. So as far as I know of now, we have not been guided by the SIU to play any specific role in as far as taking the process to the criminal side, because as you would be aware, this is not the only matter which SIU, in government they investigate hundreds and thousands of cases. And when they do find areas where there might be possibility of criminality, they themselves refer the matter to their counterparts, either directly to the NPA or to the police and the Hawks to process further investigation and criminal charges. And if we get guidance from their side that on this particular case, you also need to add, except possibly being called as witnesses if the case goes to court. If we get that guidance, the acting DG will respond accordingly. So we are at the service and at the guidance of the Special Investigating Unit. So I think that also deals with the question which says, are we going to lay charges against particular individuals? I think it's the same kind of area to say that where that decision will be taken, we will not duplicate because we believe the SIU is competent enough and more skilled and experienced in that regard in terms of following investigation than submitting reports to their colleagues in these other arms of the criminal justice investigation. So we leave that to that. And of course, as I said, if they then say to us, but because you are the ones who lost the money, we need you to also join in the laying of charges, they will guide us and will follow that guidance. Dr. Crisp will speak to the full pay or not. I think we have already spoken about the tightening of steps. I think the report, as we have said, we are acting immediately on the issues which have been raised, but we're going to do a more thorough, study. And from my side and the Deputy Minister, we will hold the DG and all the management accountable with the assistance of the Auditor General. So, because we have regular meetings at which they must report to us in terms of, now that we have learned from this, not that this was not happening, but clearly something slipped through and went wrong. So we have learned from this, we are learning from this. So on a regular basis, the acting DG, the management team, and especially those in the financial side, even though we still have an acting CFO, but that acting CFO has a full authority of a CFO, and but all managers have a financial management responsibility. So, and also we, on a regular basis, we have to make sure that the audit committee also must be active. We must, myself and Deputy Minister will have an active eye, keep an active eye also on regular reports from the Audit and Risk Committee, internal audit, and also update on a regular basis from the DG and the executive management team on at least a quarterly basis, and sometime if we pick up something. And and we also encourage our staff that if anybody picks up that there might be some irregularity somewhere, they must not waste time. They must feel free to can contact us to indicate that there are areas where they are not happy with what is happening. There was a question as to whether I have been in touch with the former minister. Well, myself and former minister comes a long way. So we talk, you know, call each other, we talk about all things. We're all members of the ANC. I mean, for your information, I mean, it's a difficult situation. I mean, the deputy minister knows. I mean, he found myself and the Minister Mkhize at medical school already. We were the ones who initiated him into politics at the medical school. We come a long way. I mean, my relationship with Dr. Mkhize, it's almost 40-something years. I mean, we first met in 1978. So you can imagine. We've been together for almost 43 years or so. Our families know each other, our children know each other. So we talk about all sorts of things, family issues. So we do talk from time to time. So I think I must make that very clear, that there's nothing personal. We have our own personal relationship, political relationship. So there's nothing personal. We do talk, and that's going to continue. Thank you.
Okay, thanks very much. So there was a question about whether the people who are suspended are on full pay or how they are suspended. Yes, they are suspended on full pay. Remember, these are people who are not found guilty of anything. They haven't even been charged of anything yet. They are purely on a precautionary basis asked to step aside so that there can be no accusation of interference by them or of them by any of the processes. Obviously, we want to keep this to the shortest possible time so that these people can be gainfully employed as quickly as possible. I'm afraid without going and doing the sums, I don't have knowledge of the actual levels of what people are paid. That would be an exercise to find out what this costs per day or per week or per month. So I'm not in a position to provide that information. I want to emphasize the story about what we do in terms of understanding the risk that we deal with. We deal with billions of rands worth of money in the health sector, and even in our department where we manage grants to provinces, we manage our own budget. So we do have the Auditor General who audits us, but we have an audit plan and we do a risk identification program prior to that. And then we have the Audit and Risk Committee that also tries to identify upfront where the risks are in what we are doing. And there are many risks in what one does, not just with handling money, but the way in which we conduct our performance within the department, how it may impact our relationships with other departments, with the WHO and other international parties we have, and so on. The chairperson of that Audit and Risk Committee is an independent person appointed from outside, and it's not the official, because that person also has to audit the Auditor General and keep an eye on what we do. So there are checks and balances in the system. Sometimes things slip through, but we are quite diligent about it. And as I said, we are particularly diligent about it at the moment. We also are busy with the process of developing a risk framework with the SIU. And we also participate in a broader family of the whole criminal justice system, looking into potentials for fraud in the health system, which the President put together. So these frameworks are there, and that's why it's very infrequent that things actually do happen, but they do happen. There was also a question about us recovering the money. Monies have already been recovered by the Special Tribunal, There's a process where bank accounts are frozen, and you heard the Minister speak about the other parties, not the 6 officials in our department or the other officials. There's a process where bank accounts are frozen and monies are recovered, but some of that money has obviously already been dispersed and spent. Recovering that money is a longer process, and that's the business of the Special Tribunal as well. We will obviously cooperate, and if there's something that I as the acting DG needs to do, we will certainly do that to recover the funds. Thank you.
Yeah, let me take this opportunity to thank the members of the media, the viewers and the listeners at home for being with us. And for the members of the media, I know you've been supporting us not only today, but also throughout the vaccination program. And we believe and that will continue to support us because this COVID affects everybody. The Minister, the Deputy Minister, the acting DG.
All right, that was a briefing there coming out from the Ronima Muyapa media briefing room at GCIS in Hatfield in Pretoria. It was being addressed by the Minister of Health, Dr. Joe Phaahla, as well as the Acting Director General, Dr. Nicholas Crisp. They've been covering issues that have to do with the department's response to the just released Special Investigating Unit